It is my real honor to introduce our second keynote speaker, Dr. Lanyard Dial. Dr. Dial was born in Taylorville, Illinois. Lanyard, is that near Nebraska? Is that
Nearer than this.
Neighbor, okay, closer than this. He received his bachelor's degree from the University of California at Irvine and his medical degree from the very prestigious Washington University in St. Louis, Missouri. Lanyard completed his residency at the Ventura County Medical Center, where we were co-workers for a number of years, and he is currently triple boarded and certified in 3 different areas. Now, I should share with you for a second, being boarded in one area of medicine is difficult. Being boarded in 2 areas of medicine is even more difficult, and being boarded in 3 areas of medicine is unheard of. So let me share with you, Lanyard certified in family medicine, geriatrics, and palliative and hospice medicine. Those are really an accomplishment and something in and of itself worthy of great praise. Dr. Dial was on the faculty of the Ventura County Medical Center, and he rose through the ranks to be residency director of the Family Medicine Residency Program from 1987 till 2001. He then assumed an even more demanding job as medical director of the entire Ventura County Medical Center from 2001 to 2006, and is currently the president, CEO, and medical director of Livingston Memorial Visiting Nurses Association. Lanyard is married to his beautiful doctor wife, Mary. Is Mary here?
No, she's working.
Mary is working. Mary is working, and has one beautiful daughter, Hannah. In his free time, Dr. Dial loves to golf, and I understand he's quite a good golfer. Ladies and gentlemen, please help me welcome my dear friend, Dr. Lanyard Dial.
Bonnie is amazing, and what Bonnie covered in the time frame she had, I had the opportunity to see her slides ahead, and I said, well, where do I and how do I help and add to this? And I'm going to come at it as only way I can, is that I'm a physician. And I've taken care of a number of people who I would call senior and geriatric, and I've also taught countless numbers of classes on how to help take care of seniors, both for physicians and for non-physicians in community-based classes. Camarillo Healthcare District does have an excellent caregiver series. It's a series of programs about how to be a caregiver. I helped them develop that program, and I teach 2 sections of it every session. So it's a delight for me to have a new audience of some of you who haven't met me or I haven't met you to teach a little bit too. I will start by saying at first, I'm going to sound a little pessimistic. I'm the eternal optimist, if you know me. I honestly believe in brighter days and times in the next tomorrow and all those great things. But you have to understand, in order to understand geriatrics and care of seniors, you have to understand what's going on from my perspective as a physician. Aging is a total mystery in science. We have no idea exactly what causes this. But anything that lives ages. Whether it's a flower, a tree, a squirrel, an ant, a human being. We're born, we come from a seed, we grow, and we wither. And we die. Whatever has lived dies. And the process of aging is a process of loss of ability and function. You are your best in your teenage and early 20s, and it's downhill from then. You will continue, sorry. No, you don't have to leave, Jim. You can, no. You will continue throughout your life to find that each part of your body and mind starts to lose things. You will lose mobility of joints, you will lose brain cells, you will lose kidney cells. Every single organ ages and loses function. You will decline until at a point you will die. Inevitable, it will happen. Couple that with the most important, from a physician perspective, second issue, and that is that diseases occur. And our job is to treat and find those diseases so that as they're occurring, you are affected by them as little as possible. So the two together, the aging process and those diseases, are what face all of our futures and our current lives and our loved ones who are aging ahead of us lives. And what will happen is that those two will cause us to lose the abilities that we have. Medicine in the United States, in my opinion, far exceeds medicine in any other country in its ability to do things. But my pessimistic side is it's broken. We have a disease-oriented system and not a health and person-oriented system. What Bonnie went through and talked about has a lot of details in there that encourage you to understand as best as you can, because the system is broken and you have to understand it, otherwise you can't navigate it. We have a system evolved. Evolved when we started learning all the science. After World War II is sort of my time frame, when we got antibiotics, we got vaccines, we got good public health, and we started learning all we could about medical care. We've evolved into a very disease-oriented system, a system that says, you have this illness, we fix it, and that's it. So all of the focus in the United States has been focused to hospitals and doctors. Hospitals and doctors are an essential part of a disease-focused system. The payment scheme for the entire system is set up to say we pay the hospitals to encourage them to get you home quickly, and we pay doctors for 15-minute visits. That does not work in a chronic disease age community. We are in the midst, in the last couple of years, and will continue over the next probably 30 years to change that system. But it needs to be changed before it'll work correctly, and we're all stuck here now. And we're all stuck trying to navigate a very complex, broken system to figure out how do we best get through this. That's my pessimistic part. Let me move to my optimistic part. So let me give you some suggestions besides what I absolutely agree with Bonnie and searching for those answers and having those conversations. One that I think is essential for us to understand is we have been sold by our system that we have now that medicines will fix us. Drugs will fix us, not healthcare, drugs. And we are taking way, way too many medications. The side effect profiles of most medicines have not been adequately studied with the complex mixture of all the chronic diseases and all the other medicines. There's no question in the field of geriatric medicine, there are sections and lectures on and on about the problems we have with pills and medications. I was told when I very first got into this field by an esteemed geriatric physician in the country that if I kept a list of all the medicines I've started and a list of all the medicines I've stopped, I would be a better geriatric doctor if my stopped list was longer than my started list. So I encourage all patients and all loved ones of patients to figure out how to help themselves or their loved ones get off many of the medicines they're on. There are simple ways to do it. It's not complex. You take all the medicines in a bag. You go into your loved family doctor, and you should all have a loved family doctor. You set the medicines down and you say, today before I leave, we're going to stop one. I can randomly pick it out, and that'll be the one. You could randomly pick it out, or let's have a conversation about what might be the most appropriate one to try me off of for the next month. I will come back. I will see you again. I will bring the medicines again, but I want to stop one of these. Try that month after month, and you will eventually find that you can reduce an awful lot of the number of medicines you're on. So medicines, big deal to me. 2, I have what has been touted as snake oil potion thought. And that is, I can get you one treatment that will actually improve your memory, improve your joints, improve your immune system, make you feel better, hands down, no question. And that's exercise. Anything you can do or encouraging your loved one to do to stay active, to develop a good exercise routine will make them better. It's cheaper than most of the drugs we prescribe. It's easier if you believe it and get there. Now, I'm not saying everyone has to run miles or get on treadmills, but you need a good exercise program. That exercise program should definitely include flexibility, balance kind of exercises as you age. So a good yoga, tai chi, some kind of organized, I can figure out in space where my body is and control that is incredibly helpful as you age. So get rid of medicines and make sure that you start a good exercise program. Encourage that in the people you're caring for. Hands down, that will help. What Bonnie touched on, which is my life, is I spend most of my time now in hospice care and palliative care. And the reason I do that is that I have, through my time taking care of seniors, recognized that that's an expertise I have and a mission and a drive I have, but also it's an area that's been neglected way too long in our society. And I have felt like if I could help people get over this hump, it would be huge. And the issue to me is that we all likely will age to a point where we will start to have significant problems. We may die before that. You may get a terrible pneumonia and die. You may get hit on Main Street tonight and die. But most of us are going to die a death that we see coming in a progression of illness and a progression of loss of function. There has to be a point at which we make the decision that life at this point is not what I want it to be. For more than half of us, it's highly likely that we will develop a terrible dementing illness. An illness that takes our brain to a place we don't want to see it go. Many of you are providing care to people with bad dementia. It's probably the current 2014 scourge of our society. Dementing illnesses are an enormous problem. I usually, and I'll do it just so you know that I've done it here too, ask an audience, how many of you would like the last 2 years of your life to be that you're in a home cared for by somebody else because your family can't do it, and during those 2 years, you're not able to control your urine or your stool, you can't feed yourself, you can't recognize your family. When your family comes in, they're embarrassed to be there and don't really want the kids to see you because they don't recognize you much anymore because you don't know who they are and you're drooling out of your mouth. And is that the last 2 years you want? 1 million people today are living like that. Why? We have not faced the decisions we need to be making as a society, as people, that says allowing that person to die is better than that existence. And hopefully, when we get that kind of illness, we will have the say that says, I didn't raise my hand when I heard it there and I don't want it now. Never let me get to that place. And I can do that, not by giving you a pill that kills you, but by making better medical decisions about how your life is going. Should you or should you not get a treatment for this infection? Should you or should you not get a feeding tube that would continue your? Should you or should you not have that bowel obstruction surgically repaired? There's so many decisions that need to be made that we have the ability to say, medicine can do this, but should it? Hopefully in my short time, I've piqued your curiosity about medical care in seniors and what's important. Chronic diseases on top of aging, stopping medicines, exercising more, dealing with the tough issues of as we age. How do we help ourselves die at a point that is appropriate for who we are? We're not going to live endlessly. How do you want your last years to be? How do you want your loved ones' last years to be? And how do you make the decisions to help those go the way you want them for yourselves and the way you want to have them for your loved ones? I'm going to end. Jim has some questions. You have some questions. Thank you so much for attending this tonight.